All right, good morning. Actually, good afternoon, right? Good afternoon, everyone, and welcome to, for those of you who don't know, this is behind me is called Belonging Park. It is a new park, thanks to the inspiration that we got from some of our staff about having a place where people could not only relax and maybe think a little bit in the midst of their day, but that also signifies one of our core values at Denver Health. I'm Donna Lynn. I'm the CEO of Denver Health. I apologize if you see me hobbling. I am hobbling. Uh, I keep thinking I'm younger than I really am. So every once in a while you get injured. But on a serious note, I want to welcome everyone who's here today to show your support for something that is really critical to the work that many of our caregivers provide to our patients. And events like this are being held across the country all week for National Suicide Prevention Week, which begins today. We hardly need a month, a week, or a day to shine light on suicide. With 49,000 deaths by suicide every year in the United States, we continue to face an epidemic. The numbers are really shocking. Firearms are used in over 50% of suicides. And this is why at Denver Health, we're not just taking care of patients, but we are, of course, taking a public health focus when we talk about firearm safety, and why we always want to encourage people to lock up their guns and weapons as we do every day. Colorado, unfortunately, in addition to the national data, Colorado ranks amongst the 10 states with the highest suicide rates. And unfortunately, nationally, suicide is the second leading cause of death for young people between the ages of 10 to 14, and also for people ages 25 to 34. So, with one death by suicide every 11 minutes, by the time this program has ended, two people in the United States will have tragically taken their lives. But we can and we must do better to provide access and resources to those who suffer and contemplate suicide. Denver Health is working across our healthcare system to provide support where it is needed most. I couldn't be prouder of everyone who is on the front lines and also in the background who care for those who suffer with such extraordinary compassion. There is nothing more noble or important than caring for people who suffer and have these thoughts. I believe this is what Dr. King intended when he said, life's most persistent and urgent question is, what are you doing for others? Doing for others is what drives so many of us to work in healthcare. Doing for others is embedded in the Hippocratic Oath that all graduating medical students take. The oath says, most especially must I tread with care in matters of life and death. And I will remember that there is an art to medicine as well as science, and that warmth, sympathy, and understanding may outweigh the surgeon's knife or the chemist's drug. I know that all of you here truly understand this delicate dance. So never underestimate the power of a kind word. I learned this lesson last year when an employee reached out to me after receiving an email about Suicide Prevention Awareness Month to say how supported they felt. This employee had been in a difficult place and was contemplating suicide. I'm glad to say that they were able to access help and care through Denver Health. Now, we all know that healthcare workers, in addition to this tremendous burden that they take on to care for others, have especially high rates of suicide. Burnout is high, and far too often, the people who so heroically take care of others struggle to take care of themselves. We certainly hope to change this by lessening the stigmas associated with mental health and suicide. The fact of the matter is that everyone can be a zero suicide champion. Zero suicide is a nationally recognized care model. Please visit our zero suicide table behind at the back of this area to learn more about how you can be a zero suicide champion. We have trainings for our clinicians, trainings for the public, and trainings for non-medical staff. If you work for Denver Health, pick up a badge buddy card. I have mine on right now. And that badge helps you keep it front of mind, gives you the link to the website. And I'm going to sign up for the training myself, and I hope you will join me. If you don't work for Denver Health, that's okay. You can pick up information, and we welcome you into the family of caregivers that want to make sure we take care of those people who are contemplating this. So you're going to hear from some compelling speakers, one of our physicians and two of our patients who are going to share with you their journey. I want to thank you for being with us today, and for the Colorado Department of Public Health and the Environment who has joined us. Please be sure to visit their table. And I'm going to turn it over to Dr. Dunn, one of our outstanding behavioral health team leaders. Thank you.
Thank you, Donna. Really appreciate a chance to be with you today. My job is to help introduce a really outstanding lineup of speakers for you today. So I'm glad Donna promoted me to physician. I'm a psychologist. I'm embedded in the psych consult liaison service at Denver Health. So we look after patients admitted to the hospital, either medicine or surgery, maybe over in mom, baby, or pediatrics, may have a behavioral health need. Sometimes why they're in the hospital is because they've actually attempted suicide. And while our very capable surgeons are helping them along that part of their journey, we get a chance to start working with them about their psychic healing. I also help look after DART, which is our de-escalating agitation response team. And I'm extraordinarily lucky, after 17 years, I still get to be a paramedic a couple days a month with the paramedic division. We have very strong leadership in behavioral health, and really buoyed by Chris Thurstone, who's our chair, Ken Navoa, who's our vice chair, but also other leaders that are very important in behavioral health, including Liz Loudermilk, Jenny Peraza, and Amanda Clare. I have been touched by suicide, and I think all of us probably have, sadly, because of the stigma. You may not be aware that somebody who was close to you who had died suddenly might have been a death by suicide. My first field training officer as a new paramedic at Denver Health, unfortunately, I think about Debbie every day, died by suicide many years after I started to get to know her. So this is important stuff, and I really appreciate that we have these efforts to try to destigmatize this national public health issue of people who are dying by suicide. So again, amazing lineup of speakers. I first want to be able to introduce to you Danielle Weiss. She is our Director of School-Based Healthcare Integrated Behavioral Health. Integrated behavioral health is a relatively new push to try to put behavioral health providers in primary care settings. As you know, it's Denver Health because we have this large healthcare system, which includes specialists in our schools, many of whom are in neighborhoods where we have a lot of inequity and issues with being able to get access to specialists. But maybe just a kid has to go to school to be able to access those folks. Integrated behavioral health is where we're putting behavioral health providers that may be along for a child's presentation to maybe getting a vaccine, maybe being seen for a sore throat. They don't need to have a behavioral health complaint to be able to be contacted by one of these providers. And so if I could bring Danielle up, I really appreciate it. Please welcome her again, Danielle Weiss.
Thank you, Dr. Dunn. Just gonna put my glasses on here. Thank you everyone for being here today. My name is Danielle Weiss. I'm a licensed clinical social worker and the Director of School-Based Integrated Behavioral Health Services here at Denver Health. I started my career here back in 2006 as a school-based therapist at West High School. and just very much value all the amazing work we do in school-based. I'm honored to be here with you today to raise awareness about suicide and to talk about prevention and treatment. Unfortunately, suicide continues to be a serious public health issue that touches the lives of many people and is very complex in nature. Mental health is one factor. However, we know that economic issues, lack of social support, physical health challenges, exposure to violence, substance misuse, racial discrimination, and access to lethal means also contribute to the risk for suicide. Nationally, suicide is the second leading cause of death for people ages 10 to 14. Sorry, you guys hearing me okay? Okay. And the 12th leading cause of death overall. Sadly, Colorado has historically had a higher suicide rate than the national average, along with other Western states. We are, however, seeing some improvement. In 2022, after a 15-year high, Colorado's suicide rate began trending downward, including a decrease in youth suicide deaths, decreased emergency room visits, and decreased hospitalizations. Disparities in suicide and suicide attempts, however, do exist. When it comes to children and adolescents, we are seeing suicide attempts increasing amongst female youths, especially Black female youths. And in the last 25 years, self-reported Black suicide attempts have increased by 75%. Black children ages 5 to 12 are twice as likely to die by suicide as their white peers, and Black teen suicides are growing at an alarming rate. Studies suggest the impact of racial discrimination is a significant contributing factor in the suicide rate of Black children and adolescents, as well as hesitancy to seek treatment due to implicit biases of those in the medical community who may misdiagnose mental health issues as problem behaviors. Other populations disproportionately impacted include the LGBTQ+ population, especially LGBTQ+ youths, BIPOC youth, veterans, and people with disabilities. In fact, in 2021, 36.6% of gay or lesbian students and 41.9% of bisexual students reported thoughts of suicide, compared to 10.9% of heterosexual youth. And according to the 2022 Healthy Kids Colorado survey, 12.9% of American Indian or Alaska Native students reported making at least one suicide attempt, compared to 6.7% of their non-Hispanic white peers. BIPOC youth are also more likely to attempt suicide and are less likely than their white youth peers to have a trusted adult. As we think about suicide, youth suicide, and prevention interventions, I would like to describe some of the suicide warning signs for youth. These include talking about or making plans for suicide, expressing hopelessness about the future, displaying severe or overwhelming emotional pain or distress, changes in their thoughts, appearance, or performance at school, changing or withdrawing from social situations or connections, changes in sleep or eating patterns, anger or hostility that seems out of character or out of context, recent increased agitation or irritability, and the use of alcohol or drugs. It's always important to recognize the signs and ask directly about suicidal thoughts. Listen and offer support and resources. To prevent suicide, we all have a role to play. And at Denver Health, I'm proud to say we have implemented the Zero Suicide Framework that provides a system-wide organizational commitment to safer and more compassionate suicide care. Across the Denver Health School-Based Health Centers, we are implementing suicide screenings at every visit and are training staff at every level to be aware of warning signs and resources for treatment. In our school-based clinics, students who indicate positive responses on a mental health or suicide screen are connected to care in as quickly as 24 hours from referral through our TRUST or Therapeutic Response and Urgent Stabilization team. Through this new program, funded by Caring for Denver, we are able to meet the needs of youths with the most acute behavioral health needs who often fall through the cracks. We know that patients are at the highest risk for suicide in the immediate aftermath of a psychiatric hospitalization, and that having a follow-up appointment within a week after discharge is critical and decreases the risk of suicide. With our trust team, we are able to meet youths prior to an inpatient discharge to begin treatment. We have a dedicated team of licensed clinicians, as well as care coordinators, a psychiatry provider to provide support, as well as resources such as housing, rental assistance, transportation, food, health insurance, and connection to other community resources. I believe we can truly prevent suicide, and I am optimistic and encouraged by changes in our state with policies aimed at improving access to quality mental health care, including programs such as iMatter, which provides up to 6 free sessions for youths, the Follow-Up Project, which connects patients with Rocky Mountain Crisis Partners after being evaluated in an emergency department for suicidality, as well as the Second Wind Fund, which is also now included as a referral for the Follow-Up Project and provides treatment for children and adolescents when financial barriers may exist. Together, we can make a difference in preventing suicide. Thank you so much, and please reach out to me directly if you have any questions.
Thank you. Thank you, Danielle. Danielle Weiss. As a parent of a high school student at East High School, very happy that we have these school-based clinics and these very important resources. We've heard a lot of statistics since we started, and I think they're sobering, but I also think it's important to know that there are human beings behind those statistics, and that probably the very best way for us to, as providers, connect with that is to be able to hear from people who have a lived experience. And so we have a couple of folks here today who are brave enough to share their stories. And so I first want to bring up Mackie Robinson, who is a Denver Health patient who is going to tell us a remarkable story about living through a suicide attempt. Thank you so much.
Thank you.
Oh, it's a pleasure.
No problem. Hi, my name is Mackie, and I suffer from drug addiction. I'm 55 years old, and I started using drugs when I was 18. I started off with marijuana and progressed to crack cocaine. I began using crack when I was 27. That is when I started having suicidal ideations. I moved to the Bay Area around that time. My addiction had got so bad, I had burned all bridges with family and the people I love. Once there, I didn't have any place to go. I didn't know anyone there, so I felt helpless and alone. I didn't know what to do, so I began walking and ended up at the Golden Gate Bridge one somber night. I'll never forget that night because the moon was full and the sky was black. Sky was black. I could see the stars. All I could think about was becoming one with nature. I felt like such a failure, so I told myself this: I'm going to jump off this bridge. This is my calling. I stood up on the ledge and looked down into the darkness. I couldn't do it. I was too scared. But that didn't stop me. I tried again numerous times. I would take medication, Seroquel to be exact. One time I took a handful of Seroquel and drank alcohol, praying that that would be the end. But sure enough, I woke up the next morning. I tried cutting my wrist too, but I didn't cut too deep. I didn't cut deep enough. Okay, I was in so much pain and I felt so helpless. I thought I would be better off dead, but I couldn't kill myself as much as I tried. I even smoked myself into oblivion, praying I would have a heart attack. Until finally I reached out for some help. I called the suicide line and they talked me down. And from that day forward, every time I had an ideation, I would be a patient at the psychiatric unit. That went on for the next 10 years. They helped me, and I'm not suicidal anymore. I just wish my cousin Mark and Angie had gotten the help they needed. They both committed suicide, and I think about them often. My cousin Mark was in his late 20s when he shot himself in the head. I'll never forget how much pain it caused my family. They found him dead in City Hotel in Colorado Springs. The guilt and shame my family felt felt is tremendous. Not to mention Ashton, the youngest sibling, blames his parents for his brother's demise. I still often think of him. In 2020, I lost my dear friend Angie to suicide. She overdosed on blood thinners. Even though they had rushed her to the hospital shortly after we got the news, it was too late. Her last words were, "I screwed up, didn't I?" And then she was gone. My heart still aches. Thank God I didn't have the courage to take such drastic measures, even at my lowest point. Just know suicide is not the answer. No matter how bad it may get, there is always tomorrow. I am so grateful to be alive today. Life is so precious, and once you're gone forever. Mhm.
Thank you.
Thank you.
Thank you very much. That was a very touching story. And so next up, we have Myra Nagy, who brings a perspective of being a Denver Health patient who's lost friends to suicide and who's helped others living with suicidal ideation. Thank you, Myra.
Hello, my name is Myra Nagy. I want to tell a story about how when I was a teen, I had some friends that were trying to commit suicide. One of them, I was able to take the meds away from them to stop them. Another one, I didn't even know that I was helping her until at the end of the story, her talking with me and I trying to, give her answers. I actually saved her life. Then later on, as I was getting older, it was a group of us that had a friend, and we used to make names about him because he was sad all the time, and then he ended up committing suicide. So I carry that guilt with me of the name that I have for him. And then more recently, going through unhouselessness, I've saw a lot of people that committed suicide. And with that, I decided that I wanted to get some training. So I took some QPR training so I can learn how to ask those hard questions, because I believe that if we're not asking the questions, there's a chance that someone could commit suicide. I was living at a building just a year ago, and this guy that lived in my building was telling me, "Hey, I got to go grab my meds. I'm gonna take all my meds." And I didn't understand that that was a sign. And then I saw him actually take the meds and throw the bottle. And at that point, I said, okay, I'm gonna go ahead and tell somebody about it, because I still was scared, even though I had the training to ask those hard questions. So I think it's important at any aspect to talk to someone about it or share with someone else if you see signs from anyone, if you're afraid to ask those hard questions. Now I feel I'm more confident to ask those hard questions, even if I'm going to feel sad about it or feel guilty about asking, I'm willing to ask those questions. So thank you for letting me share this information with you guys.
Thank you, Myra. You're not alone. And so Denver Health brings an enormous number of resources and available to try to help with this epidemic of suicide. And so we're remarkable. We're one of the only only dedicated psychiatric emergency rooms with a psychiatrist 24/7 as part of our psychiatric emergency services through the ER. Through the leadership and vision of Chief Berskevich and the paramedic division, we have STAR that has been very successful, which pairs a social worker and a paramedic or EMT. We have our mobile crisis resources. We also have clinicians across the city. But really what it takes sometimes is just being willing to listen. And it also sometimes means being willing to reach out if you're having trouble. If you're an employee at Denver Health and maybe thinking about suicide, remember we have our Restore program. We also have other individuals throughout the hospital that may be willing to talk and guide you towards resources. If you have a loved one, 988 is the phone number to call. You could also call 911, ask for EMS to respond, not the police, or go to an emergency room. Again, one of the things that we see with people who die by suicide is disconnected from other people. And so you can do your part by reaching out to that family member you haven't heard from for a while, sending a text to that friend who's might be having a tough time, and otherwise being there for each other. It's one of the most remarkable things about being a long time employee at Denver Health is the camaraderie and how I feel when I come to work. It's because we do important things together. So thank you, Donna Lynn, for your leadership, and to CDPHE. We also have the National Foundation of Suicide Prevention here. We've got some resources in the back. And so please, thank you very much for coming out and supporting this very important topic. Again, my name is Tom Dunn. Thank you very much. We appreciate you coming out.